by Cornerstone Family Dentistry?
Okay, I mean, we're a pretty comprehensive dental office. We offer more than the average general dental office. We do cleanings, we do fillings, crowns, all of the normal things, but we also do dentures, we do implants, we do extractions, we do tooth whitening, we do lots of family dentistry, we see babies, we offer services for babies called frenectomies, where we take care of if they have a tongue tie or a lip tie. And then we also just started offering sedation. So for more complex treatment so that the patient can actually be asleep during the treatment or moderately, sedated. Yeah.
So, I mean, you cover all the bases, babies all the way up to the senior citizens.
All the way up, yep.
Talk a little bit about the implants.
The implants, I don't actually place those, but we have, I think there's 4 of our dentists, 3 or 4 of our dentists that place the implants. My brother's one of those. And they do something so simple as if you had a tooth taken out and you have the empty space there, they'll put an implant there and then attach a tooth to it eventually once the bone heals around the threads of the implant. And then they do very complex things where people are losing maybe all of their upper teeth and they're placing 4 or 5 implants and doing either a denture that locks onto the implants or even a fixed appliance that you don't take in and out that's completely implant supported. So to the patient, it feels just like their natural teeth.
Oh, and that would be so great, wouldn't it?
Yeah, it's a great decision when a patient can do that.
What's the cost on something like that, doctor?
That's a good question. So we do a lot of discounts for our patients when we're doing more complex care, when they've committed to us for, from start to finish. Since we take care of everything, from the start to the finish, we'll do an implant case where they have 4 implants placed on just like the upper arch and do an implant denture, and we'll do that for about $12,500, which is about half of what you're typically going to see when you go to like an oral surgeon and then you go to your dentist and you kind of make the rounds to all the different providers. So
what about, does insurance pay for any of this or no?
Yeah.
Oh,
yeah.
It does.
So
okay.
Whatever your insurance maximum is, usually they'll cover that. But the insurance maximum for most dental insurance plans, they'll cover $1,000 or $2,500 in a year. So then you're still looking at like it's going to be $10,000 out of pocket to do it. So,
okay.
Yeah.
So let's talk again a little bit about the history of the Cornerstone Family Dentistry. How did this all come about?
Cornerstone Family Dentistry was started by me, Mindy. I go by Dr. Mindy at work. And this was started back in the end of 2014, the beginning of 2015. And I just wanted to have my own practice. I was an associate before that, and I wanted to have a practice that stood out from other dental practices by being a place that everybody would love working and want to work and be incredibly happy, feel like they could go home to their family and pour into them. So I just wanted a work environment that would build people up, and then in turn, I hoped that would translate into patients feeling like they were well loved and cared for. And so that's really the difference that we focused on, is just having a culture and a group of people that are really connected, committed, but also trying to better our lives in all realms.
You mentioned your brother. Is it a family affair?
Yeah, so my brother, I talked him into joining us in 2015. So he came in September of 2015. So I had one practice in Davenport. It was a startup practice. That means I had no patients, started from nothing. And then while that was building up, I was helping a dentist in Morrison who was ill. That was Dr. Simpson. And while I was helping him, he had some health issues and he ended up passing away. And so as I was working there, his wife was looking to see how she could sell the practice. Selling a dental practice in a rural area is a little bit more difficult. There's not a lot of dentists that are excited to go practice in, I don't think it's an incredibly rural area because I grew up, south of the Quad Cities and went to Rockridge High School, but most people who are becoming dentists are looking to go to like a Chicago or even like directly into the Quad Cities. So the market is very slim. So his wife couldn't find very many opportunities.
But I imagine it's very appreciated when a dentist comes into a community like Morrison.
I think, yes, it's a great relationship that the dentist has with the patient. But so I wanted to buy the practice, so my brother was working in Wisconsin at a community health center, so I talked him into coming down to work with me instead. And so he's been here ever since.
Is he a dentist as well?
Yeah, so he's the one that does all those crazy implant things I just talked about. He's the one who sedates the patients, and he's the smartest dentist of the family.
In the family.
Yeah.
So how'd you end up in Comanche?
Yes, and then it just got more complex, and it just kept going. So then we had the 2 practices, and then we got a letter in the mail one day in our Morrison office from Dr. Gary Lowe. And he just said, I see that you guys have had some success, taking over a practice in a rural area. I've been looking to retire. I haven't had very many opportunities or buyers looking at my practice. I've had it up for sale for a while. Can you help me make some connections or see if there's any way like I could find a buyer? And so my brother and I went to dinner with Dr. Lowe and his wife Carly, and they were just amazing. And so it's like,
I know the Lowe's pretty well.
So then
yes.
we just fell in love with them, and we were like, oh my goodness, they're so amazing. And we checked out the practice, and then we didn't know anybody who would want to buy in a rural area, so we just said, well, we'll do it. So we had an associate at that time, Dr. Jackie. So we asked Dr. Jackie, would you be willing to help us, spread this a little thinner? And then we would look at hiring another associate. And so she said yes, and we said, okay, we'll buy it. So that's how that went. And then similar in Erie, just a couple years later, somebody contacted me in the same way and just said, we know you guys are in the rural area out here, and that you've been successful with, 3 practices now. Would you like a 4th? And we said yes.
So how do you fill all these roles? I mean, how many dentists are on board?
We have 4 practices right now, and we have 6 dentists.
Okay.
But our dentists, because of the style of our practice, we have... Actually, let me explain to you our core values.
Okay.
This will make a little more sense. Okay, so our core values are family first, which I think you understood just from the very beginning when I explained that. So that means we love work, we want to be at work, but we want work to help us to be in the best roles in our families too, and not take away from it. So family first, and then the golden rule, which everybody usually knows what that means: treat other people the way you want to be treated. So we have family first, the golden rule, and now I'm skipping on one. Let me go to the other ones. We have measurable growth. So that means we always want to be growing, thinking about growing. And then openness to change, being willing to take on another practice or, doing anything else.
And you certainly are.
And our last one that I kind of skipped on, it's called willing to wash the dishes. So what that means is that we want everyone in our practice to be willing to take on roles that maybe aren't specific to their job description. So that could mean a dentist taking out the trash, or, we try not to have a hierarchy of who's more important, who's less important. So that being said, we tend to attract dentists that are very values-based. So they might not want to work as many hours. So we have one dentist that works 2 days a week, and he was a retired dentist, and he decided that he still wanted to have an impact with patients and with practices. And he had his own practice for many years, and he decided to work with us for 2 days a week just so that he could continue to fulfill his purpose. And then we have we have another associate that's brand new that just came to us from Texas. And then we have Dr. Jackie that I talked about earlier. She's been with us since 2022, I believe, or maybe even 2021. We have Dr. Foster. She's with us in a couple practices, Erie and Morrison. So Dr. Naert, Dr. Foster, Dr. Tasia, Dr. Jackie, and then Dr. Mindy and Dr. Craig.
Okay.
Dr. Mindy and Dr. Craig were the brother-sister owners.
Oh, that is
Yeah.
great. We got to take a break for the weather, and there'll be more with Dr. Mindy here on KROS.
You'll find everything you need in one stop at K&J Hop and Shop in Sebula. Whether it's pop, ice, groceries, sandwiches, chicken, pizza, self-serve gas, or fishing supplies, they have it. Plus, enjoy an 8-piece roasted chicken Sunday special with potato and salad for $17.99. Stop by K&J Hop and Shop, 416 Broad Street, Sebula. Open 7 days a week from 5 a.m. to 9 p.m.
It's time now on KROS for the Storm Track 8 weather forecast, brought to you by Midas.
Your Friday is going to be a day worth getting outside for. Soak up the sunshine, the really warm temperatures. There will be gusty winds and high fire danger, so no outdoor birding today. We'll see temperatures soar into the mid to upper 60s. For tonight, mostly clear. Temperatures will return to the 20s. With your Storm Track 8 weather impact forecast, I'm meteorologist Andrew Stutzky.
Currently, we have sunny skies and a temperature of 64 degrees. Winds are out of the south at 10 miles per hour. The weather report on KROS has been brought to you by Midas.
Your Clinton Midas, locally owned and operated for 49 years. Trust your vehicle to the Clinton Midas. They are now offering savings on brakes with up to $80 in savings. Get the complete details at your Clinton Midas. Of course, for maintenance, count on them from everything from an oil change to major repairs. If your engine light comes on, let the Clinton Midas give it a diagnostic check. Tires, batteries, windshield wipers, and much more at the Clinton Midas, 1432 Lincoln Way. Trust the Midas touch. Don's Jewelry in the Lyons neighborhood. Visit Don's and experience the one-of-a-kind beauty of a rare and forever natural diamond today. Rare and forever diamonds are graded to a new standard. At Don's Jewelry, they feature an outstanding selection of fine jewelry with rings, necklaces, earrings, watches, all backed with knowledgeable salespeople and an experienced service department. You're invited to pick up their wine, Diamond Heist, from Wide River Winery. Don's Jewelry, 200 Main Avenue in the Lyons neighborhood, Clinton. Pleasure to have Dr. Mindy and once again Cornerstone Family Dentistry, Davenport, Morrison, Comanche, and Erie. So where else you looking, Dr. Mindy?
I don't know. We're open to it. You know, we love the rural areas, so if there's any dentists out there thinking that they might want to sell their practice, maybe they're listening today.
Membership program, talk about that.
Our membership program is a really great thing that we started many years ago. It's just for our patients that might not have insurance. It comes out monthly. It ends up being, it's $365 for the average patient if they don't have gum disease. So it's like $1 a day, and basically it covers their cleanings twice a year, their exams, if they end up having an emergency exam, all of their x-rays, which can add up, and just their care for that year. Now, if they end up needing, you know, fillings or crowns or other things, then they get a discount on that. But it does cover all of their preventative care.
So what made you do something like this?
Well, we just saw, especially in the Morrison area, that there was a lot of that we had a large demographic in the area, you know, like just over 60, where they just didn't have dental insurance anymore from their employer. And so rather than, you know, trying to make them pay for everything piecemeal each time that they come in, it just made more sense for it to just go through just like a monthly bill. And they love it because it gives them discounts on treatment. And so we have a large number of patients that are now on our membership plan.
Do they basically, for a cleaning, is that like every 4 months, 6 months? What do you do with the cleaning?
We do every 6 months for most patients that are healthy with their gums. Now, if they have gum disease, then they do go on a rotation of every, you know, could be 3 or 4 months.
Okay, very good.
Yeah.
So the therapy dog.
Yeah, that's my dog, Yogi. He does a lot of therapy for our employees. He loves to, you know, sit on people's laps and try to beg for food and all of that. We do bring him out every once in a while when we're having an extraction on a child where they just need some sort of comfort. I've used him, you know, in people that are coming in from the nursing home and they're sitting in their wheelchair and they can't get up, and so they'll just pet him while maybe I'm doing an extraction. So yeah, so we try to make him work sometimes, but most of the time he's sleeping, so he only gets paid with food.
What kind of dog is he?
He's a black lab.
Oh, okay.
Yeah.
How old is Yogi now?
He's 4.
Oh, he's still a kid.
Yeah.
My goodness.
Yeah.
How'd you end up getting him?
We had a dog before him. So we had a dog, another black lab, for about 12 and a half years. And then my husband just thinks he always has to have a dog in his life. So
Well, there
we
you
ended
go.
up getting another one.
So that's great to have. So you picked out, I thought you were going to go with the song you went with last year, because I enjoy
switched
the
it up.
song. I play it every once in a while
Yeah.
in the mornings. So what song did you decide to go with?
Okay, so last year I went with The River from Garth Brooks, just to do a shout out for that, because it is one of my favorite old time songs. But this year I went with Good Day with Forrest Frank. And that is just because it just has such a great message about how life is so wonderful, it's so good. It's just about looking at the sunny side of life, and it just pumps you up a little bit. It's a great song for today.
Well, let's hear it. It's part of a presentation at a school.
Yeah. So
Talk about that.
I was at my kids' school this morning. February is Children's Dental Health Month, and so we like to go out and educate kids about how to take care of their teeth so that they can have them for the rest of their life. So we're talking to them about brushing, flossing, what foods are good for your teeth, what foods are bad for your teeth, and really, really hammering home about how they should be drinking lots of water and not juice and pop and Gatorade.
Well, that is a good thing to do. Do you do a lot of these?
I love to do them, so yeah, I tend to do more of them than probably the average dentist.
Biannual mission trip. Talk about that.
We're excited about that.
You got one coming up?
So yes, so we have a mission trip coming up in October, and last year, so actually 2024 was our first year that we went to Turks and Caicos, and we took our entire team, everybody who wanted to go to Turks and Caicos for a week, and we did mission work. We did mostly extractions. Our hygienist went and did lots of really difficult cleanings. We did extractions, we did fillings, we did stainless steel crowns on kids, all kinds of things, whatever we could do at Turks and Caicos. And we worked 5 days a week, Monday through Friday, and just saw a ton of patients.
So where is Turks and Caicos? I'm sorry.
Turks and Caicos is in the Caribbean. So,
Okay.
Yeah, so we just flew down there, and it's a little island. It's beautiful. It has teal waters. So even though we were working super hard during the day, we were sweating and barely surviving. And then at night, we would go to the beach and relax, and it was beautiful and felt like we were on a vacation at night.
How did this come about?
My brother has been doing mission trips very often ever since dental school, and I've done maybe one, but then my kids were young and I didn't do many mission trips. He's been very good about doing them every year, very regularly. And so he's always had a heart for just mission trips, and we really wanted to be able to share that with our people who maybe might not ever have a chance to step outside of, our local area and just see what the world is like and treat people that are really, really in a vulnerable population and don't have as much as we do. So
Is it always Turks and Caicos, or have you gone to other places?
we haven't gone to other places yet, but we may eventually do that. We've really enjoyed going to Turks and Caicos. So
Yeah. Currently accepting new patients?
yes, we're always accepting new patients in all of our locations, and we do all sorts of services. So we're usually a good fit for anybody from having a newborn baby all the way to, we like treating people that are even losing their teeth and needing, dentures or implants or things like that.
We skipped on that one, you're going to have to pronounce it.
Oh, frenectomy.
Yes.
I touched on it a little bit because
Okay.
you asked what our services were.
We're right,
So
okay.
yeah, Dr. Jackie and I do a service called frenectomies. And so that's usually done on babies, but it's where they have a tongue tie and they might have a struggle to eat, or as they get older, maybe to speak or, something like that. And it's the little string underneath your tongue that holds your tongue to the floor of your mouth. And if it's too short, then it doesn't allow the tongue to move in the way that it needs to. And so we have a laser that we use to take care of that short frenum. And then once we do that, then we have a lactation consultant that works with us, and we kind of work them through their struggles so that the baby can function and do, breastfeeding or bottle feeding like they should.
Good dental hygiene is so important because it's not just your teeth, it can affect your health. It can affect your heart.
Yes. So, yeah, if you could just come to our practices and tell all of our patients this, our hygienists are trying to explain to people why, we need to take really good care of our teeth, especially if you tend to be somebody who is heading down that road of having gum disease. A lot of the bacteria that we have in our mouth for gum disease specifically, it translates to a lot of health risks in other areas of our body. Just like you said, our heart, our lungs, our brain, our blood, we can go septic. And as we start to get older and we don't address our mouth, we are putting ourselves in a very vulnerable situation so that, you know, if something comes and we have an illness or, you know, something hits and you have all of that bacteria in your mouth, it could very well, you know, take you down.
I was a runner. You still run.
Yes.
How was your run today?
It was a great run today, although now I'm kind of jealous because I went out too early when it was still cold and I was in a sweatshirt. And right now when I just came in, I felt like it was so warm outside that I might have to go for another run.
I used to do a 2-a-day every once in a while.
Yeah,
You felt
this
good.
might be one of those days.
Well, there you go. Do you have a regular route that you go to?
Well, I love, my husband and I will run down by Arconic. There's a little trail there right by the river. And so we'll run on that trail and you can go as far as you want. It's right on the river. The Quad City Marathon runs on that trail for a little while.
Oh.
I mean, the trails in the Quad Cities are just amazing. There's so many trails that you can take. So I love all of them.
And remember, when it's like the wintertime, run into the wind, and then you'll have the wind at your back as you're coming home.
I have a friend that I go running with, and sometimes we'll park her car at one spot, and we'll drive my car to the other spot just so we can run with the wind the whole way.
And you say you got a daughter who may be following in your footsteps, but not as quickly in your footsteps.
Well, she's in track and cross country and really enjoying that. So yeah, as a competitive runner when I was younger, it's hard for me to just you know, look at it as this is just for enjoyment for most people. I tend to be a little too competitive, which is why some people don't enjoy running with me.
Doctor, thank you so much for coming in.
Yes, thank you.
The Central DeWitt girls basketball team is back in Des Moines for the state tournament for a second straight year. And for the second time, their opening round opponent will be Norwalk. After dropping a close decision last tournament, the Sabres are looking for a measure of revenge. KROS will provide live